All right, hello everyone. Thank you for taking the time this afternoon to join us for our NCCRT Public Awareness and Social Media Task Group call. We welcome you all to our second year providing these pre-annual meeting task group briefings, updates for members. And we are extremely excited to share our progress we've made on our 2017-2018 Task Group Action Plan. For those new to the NCCRT, much of the work of the Roundtable is developed and completed through the commitment and voluntary actions of our members within our task group infrastructure. We currently have 6 active task groups with focus areas in community health centers, evaluation and measurement, family history and early age onset colorectal cancer, policy action, professional education and practice implementation, and public awareness and social media. Each year, our task groups hold working sessions during the annual meeting to discuss emerging trends and topics, identify knowledge gaps and barriers in colorectal cancer screening, and consider strategic actions that the NCCRT can take in addressing these issues to better assist and serve our partners committed to increasing colorectal cancer screening. So our first step is inviting this active participation engagement from members for all our annual meeting attendees to take part or watch a replay of these short task group webinar briefings. During today's webinar, task group co-chairs will recap the work of the task group to ensure that we don't spend valuable face-to-face meeting time getting the group up to speed. Rather, the intention of the in-person time can be used to advance key issues on our projects and activities. While there will be time at the end of this call for task group questions, we hope that we have kept these calls short, informative, and to the point for your convenience. And then just before we get started, I'd like to share just a couple of other reminders and comments. First, task group meetings for the NCCRT annual meeting will take place on November 14th from 5 to 6:30 p.m., with the formal sessions of the annual meeting occurring on November 15th and 16th. So please do make special note of the task group date and time, as it occurs the evening before the opening session of the 2018 annual meeting. Second, should you have any ideas between now and the annual meeting on how we can better engage task group members, please do share those ideas with me, Caleb Lavelle, the NCCRT Program Manager, or our task group chairs. As the NCCRT continues to grow and we look to transition our 80% initiative into 2019 and beyond, we want to make sure that we are giving ample opportunities to our faithful NCCRT members to participate and share their ideas and talents. And then finally, please do make sure to check out the NCCRT website frequently, as it will include updated information on the annual meeting agenda and speakers, task group activities, and constant stream of new resources intended to help you in your everyday work. So I think that's enough for me for right now. At this time, please make sure your line is muted, and I'll pass over to our task group chairs. And I think, Angie, you will be leading us off.
So welcome. We are very excited to have you. Dave Greenwald and I are the task group co-chairs. The agenda for this meeting will be to review the charge of the task group, our accomplishments, our current projects, and possible topics for annual meeting task group sessions, followed by a Q&A. Again, next slide, I'm very honored to co-chair this group with David Greenwald, who is with the American College of Gastroenterology. I'm Angie Davis. I'm the president of Fight Colorectal Cancer. Next slide. Our charge, which is a big charge and been an exciting one for this particular task group, has been to help unify and promote colorectal cancer screening and awareness through multiple channels. Next slide. The themes of this group have been varied, but has been very successful and helpful to the membership at NCCRT. We've been able to create communications tools, plan for March Colorectal Cancer Awareness Month, provide opportunities for participation of the membership, provide a forum and recognition to showcase the good work that has been done for 80% by 2018 and the many success stories that have come out of that campaign, define the role of survivors and how survivors can also support the efforts of increasing colorectal cancer screening, and to continue to create and advise culturally competent outreach programs with a multitude of toolkits to include the ones that you see here. And I think they've been widely used by the membership and beyond, which has been extraordinarily exciting and useful as we continue to increase awareness about colorectal cancer screening and encourage the 23 million people that haven't been screened to be screened. Today, Dave is going to walk us through some of the key aspects of our successes. He's going to be reviewing the new initiatives to come, and then how we're going to engage our partners moving forward, which has been very exciting. So I'm going to turn this over to Dave to review quite a bit of content in a very short amount of time, but I think it shows the breadth of work that this task force has done over the last year.
Thanks, Angie, and thanks, Caleb, and thanks to all of you. I can see there's 22 people listening on the phone, and the rest will be able to hear this later through a recording. So appreciate your time today, and we will be seeing you at the meeting in November. So what I wanted to do is take the Public Awareness and Social Media Task Force through, sort of what happened in 2018, recap it a little bit, and then Angie and I and Caleb will talk about, what's going to be in 2019 and beyond. And I want to again credit Caleb and Emily and Mary for putting together this idea of having this recap before the meeting, because we used to do this during the task group meetings at the meeting. We'd spend a lot of time doing that, and this is actually probably a much more efficient way to do it. And you can have sort of all the information at hand, a month or a couple weeks before the meeting. So in 2018, sort of the initial plan was to think of what was going to happen in 2018 and then what was going to happen beyond it. So, a lot progressed from 2014 when the 80% by 2018 program really started. And the idea here was to finish strong, to clearly declare success. And, again, as this task group is charged with sort of like the public outreach and the social media outreach, it's really important that we focus on success. 80% of the country remains sort of an aspirational goal, but there are 80% successes all over the place, and we need to celebrate them. We also at the same time realize that 2018 is ending, so be clear that a new initiative is coming, and to start to understand what that's going to be as the larger roundtable figures out what that's going to be, and then send that out to the public and get input from everybody who's been engaged already on what's going to happen next. So next slide, Kel. All right, so the idea of finishing strong was really loud and clear in January, February, and March of 2018 and in 2017 as we were coming into 2018. So the idea was to take March 2018 to the next level and finish strong. And there was a lot of amazing stuff that happened. There was this coast-to-coast screening drive, driving towards 80%, with really signature events in New York City, in Los Angeles, and DC, and these watch parties, and I'm going to show you some pictures of all of those. So next slide. Okay, so what you can see on the bottom were some pictures from New York City, again, opening the NASDAQ opening bell, which we've done a couple of years in a row, often the closing bell, but here was the NASDAQ opening bell on February 28th, so just before March. Moved to Los Angeles for the really amazing kickoff. That's Richwender right in the middle at the kickoff in March 8th, so truly coast to coast here. And then advocacy efforts on March 20th, with a lot of blue shirts in Congress, the call on Congress, which was incredibly successful. And again, you see a lot of the NCCRT members in the strong arm selfie position on March 20th. The roundtable joined Fight Colorectal Cancer and the American Cancer Society, and support from Mayo Clinic, Exact Scientists, UPS, and many, many others that many of you are very familiar with. Next slide. All right, so again, finish strong. Help me, that's Craig Campbell. I always get his name wrong. Is that right?
That's right.
Good. At one of the signature events, celebrating all that had happened over the year, but particularly featuring celebrities and celebrating survivors. And really this was, really sort of both looking back and looking forward, and celebrating the 80% by 2018 National Achievement Awardees as well. I believe the picture at the bottom was from the Los Angeles event, although I'm not sure. And really there were just some tremendous successes that were celebrated through the year. Next. All right, here's some more pictures from those sort of coast-to-coast tour. So if you look on the upper right-hand panel, that's the UPS support that I was talking about before, where we had an UPS vehicle sort of celebrating this coast-to-coast thing. We see Dorado Brooks at the bottom right, and people really, really watch this thing. So the Blue Carpet Show and the coast-to-coast live stream show had over 23,000 views and reached almost 70,000 people. The web and social media casts, more than 100,000 people, and I love these numbers, generated 37 million impressions. It's very, very cool stuff. So we were very successful at this coast-to-coast drive. Next slide. And finishing strong happened all over the country. So there's pictures of the Arkansas governor signing the proclamation, the pledge. There was a main watch party. The blue building in the middle is the Denver City County building. South Carolina Medical Center in the bottom right. The New York City radio show in March. You can see me sitting in the background there with Mark Pochapin and Seth Gross. And I point your attention to the bottom left. That's the map of the events that happened through March, and particularly notice the eastern half of the country, not to say anything about the western half of the country, but if you just look at the eastern half of the country, you can see that eventually there were so many blue stars that you couldn't see them as distinct events. They really sort of crowded out the map. Next slide rather, and next party. So, you know, a lot of successes, as I said. There was work going on all along to declare these successes. A lot of work going into how to evaluate these successes by the Evaluation and Measurement Task Group. A success story done as a qualitative report. And then if you recall, this group was talking about 30-second video success stories in the past. I think that's something that we may want to continue to consider. Next slide. Okay, so more successes and more accomplishments. A couple of manuscripts that were made in partnership with the Evaluation and Measurement Task Group, which have been finalized and submit for publication. So there was an 80% overview and an 80% progress report. There is a glossy report that will sort of celebrate the being thankful for 80% move, and there's a companion video for that too. In the American Journal of Gastroenterology, there's a red section editorial that talks about the 80% by 2018 campaign. And again, that call for these success videos. And I think we really, as a group, need to really focus on success videos, success stories, take them wherever they come and show them off, and then send them out to other people for consumption. Next slide. So, you know, another thing that was planned for fiscal year 2018 was to, you know, be clear that a new initiative was coming and get partner input. So it's recognized really, really early on in 2017 and then in 2018 that we were going to get to the end of 2018. And you obviously don't want the campaign to stop, but you want it to continue, but you also realize that it needs an update and sort of a new initiative. So again, this is the Public Awareness and Social Media Task Force. So we need to be sort of ready for that in advance. So at the beginning of 2018, the strategies were to look at the 2014 market research that had been done and update it where it needed to be done. Part of that involved a listening tour to get out to people to understand what the next campaign could look like and would look like, and then ultimately to release the new initiative. And there have been work going on through the year and then meetings through the year to define that. So 2 phases of that market research have now been completed. They include the 50 to 54-year-old group, which turns out to be in the 50 to 75-year-old group, the group that is least screened. There's been some focus on rural populations, on the insured populations, because a lot of the unscreened turned out to be insured. Continued focus on African American screening rates. And then now, with a change in guidelines from the American Cancer Society, also market research on the impact of this on 45 to 49-year-olds. The phase 3 of this market research campaign will begin after the annual meeting. So the listening tour, to dial in on that a little bit more, included an opt-in survey to all partners in the round table, and then key stakeholder interviews with 3 in-person focus groups excuse me, that were conducted. And there were partner surveys looking at various slogans and descriptions for what the new campaign and new initiative would look like, and that still is in progress. And indeed, the survey was found as the Survey Monkey Next 80 campaign. Next slide. So, excuse me again, in the annual meeting, you'll notice that market research is going to be presented with findings about the unscreened and how to get them screened. The presentation will be made at 3:30 to 5 p.m. on Thursday, November 15th, and it will be made by Bill Willard, who's the Director of Marketing Research at the American Cancer Society, and Michelle Oberdeen, who's a project manager at the marketing firm that's been helping with this. Next slide. Okay, a little bit more of celebration. So here's the pictures of the 2018 awardees for the National Achievement Awards. The group was proud that we had 60 nominations that were received. The grand prize winner was from the Oklahoma City Indian Clinic, and I think the most impressive thing there is they've increased their screening rates in age-eligible patients from 14% in 2007, and 9 years later they were up to 64%, and an increased patient volume as well by 27%, with a variety of honorees listed on your slide as well, and some pictures from some of the ceremonies on the right side, including all the funky glasses and mustaches. Next slide. The website was reinvigorated in 2018, so it would be redesigned and improved. It proved very successful. Some statistics for you: the page views and unique page views doubled year over year. Average time on the page increased by 20%. New users up over 100%. The page views have been seen by over 150 or nearly 150,000 people since the launch. The thing that people look for most are the Resource Center, which I must say is incredible. The 80% campaign page, which is very impressive to look at, and I've used in presentations on this topic. The National Map of Pledges, which is also very, very impressive. The 80% pledge itself, and then descriptions of all the various events. The top resources that are being used are the stool-based testing for colorectal cancer screening, a clinician's reference, the communications guidebook, which has been updated several times over the years, a sort of a step-by-step manual for community health centers as to how they would approach and increase screening rates, and then the Colorectal Cancer Awareness Month social media toolkit, which is also really another excellent resource. So these are the top pages and the top resources on the website. Next slide. This is that interactive map of pledges. You can find out where your state stands by clicking on the various things. A cool thing to do and a great thing to tell others to do. Next slide. Okay, and so that gets us to 2019. And Angie, maybe you want to talk about a couple of the things that will be happening, and I'll chime in.
Sure, sounds great. So we are already kicking off 2019 by starting the planning efforts and mobilization efforts for the kickoff launch party. We're hoping to know more about the 80% and beyond efforts at that point, develop compelling messaging to transition beyond 2018, hold 2 video conference calls on the launch of the new campaign, post-annual meeting, development of the NCCRT communications and marketing plan, really looking at opportunities for us to engage membership with blogs, a calendar of social media opportunities to engage and collaborate. So I think that as we leave the annual meeting, there will still be a lot to do, an opportunity for us to start looking towards March 2019 as a group and as a task group. The market research update, I think Dave has covered some of the phases as it relates to what we have done and what we hope to do here right after the annual meeting, but continuing to look to the membership to have input into the colorectal cancer messaging and testing between November and December 2018, which is really coming up soon, and we'll be asking for your input along the way. Development of the 2019 communications guideline from market research. This is a buildup from the 2014 market research toolkit, and then planning the work into how can we address rural health messaging as well. I think that's something that this task group brought up, and it was a very important topic around how can we better message and develop tools for rural health efforts. Dave, would you like to cover the resource review and assessment?
Yeah, so one of the things that meetings that have gone on over the summer about where this campaign will go post-2018 has really been focusing on the importance of family history and on-time screening. Came up a lot with the idea that if you recommended lowering the screening age to 45, how do you address that younger population, and is it great to address the younger population and get people in on time, even if the on-time age is 50 or 45, doesn't really matter. So there's going to be increased focus on family history and appropriate messaging for on-time screening, and a family history for each age group. The Family Please group, task force basically, will be looking at whether that information needs to be refreshed. And then this whole idea of early onset colon cancer needs to be consistently addressed. Much of the material has focused on 50 and above, and so everything needs to be looked at now afresh. And also bringing attention to the groups in their 20s and 30s and 40s who have early signs and symptoms, particularly rectal bleeding, to get them proper follow-up. Finally, we want to make sure that we're engaging all of the stakeholders that we can. One of the things that has become very clear is that colorectal cancer screening isn't its own little island, but can easily be paired with other healthy lifestyle screening activities, including mammograms, getting flu shots at the same time as you do a FIT sample, for example, cancer screening week. All of these things can be packaged and bundled together in a way that improves both colorectal cancer screening and the other screenings as well. Next slide. And then, we're even thinking about 2020 and sort of where we go from there, and we're going to want your help during the meeting to help prioritize some of these things. So, what's the campaign-related communication going to look like? Is it going to be reaching out to that 50 to 54-year-old group that I said is less screened than the group older than they are? Are we going to look to employers, particularly large employers, as a way to reach large numbers of people at the same time? How do we get this message of on-time screening out to as many people as possible? And what are the best ways in 2018, 19, and 20 to get to people? One-page information, briefs, social media. We're going to look to all of you for help. Angie mentioned this rural health toolkit, and we're going to work more on what that's going to include, including access and transportation and so forth. I already just talked about the Family Please, whether that needs to be repackaged or remarketed. The market research will help identify any new areas that we need to tap into. Patient portals is yet another opportunity that we really haven't tapped into in terms of sending out reminders or sending out information that it's time to be screened, for example. We have these coordinated communications plans that we've looked at before and we'll be looking to for guidance as to how to get the message out in the future. I think these survivor stories have been critically important in telling the story of colorectal cancer and the success stories that we've had. But equally important are going to be getting more stories about cancer avoidance due to, for example, early detection by a FIT test or a FIT DNA test or a colonoscopy where a polyp was taken out that ultimately leads to avoidance of cancer. So those are more success stories. And then lastly, as we've been talking in these meetings, there are unique challenges everywhere. One of the challenges that became obvious over the past year and a half is how difficult it is for patients who are in settings of natural disaster. Puerto Rico was the one that came to mind during the meetings that we were having earlier this year, but they apply equally well to all sorts of other natural disasters that occur, and that the need for screening continues on despite all of that, and we have to reach out to those communities. So those are the things that we're thinking about when we talk about 80% and beyond, or whatever this new campaign will be called, and we'll be asking each one of you in the Public Awareness and Social Media Task Force to help us with the bottom line there, which says what else. So I'm pretty sure that wraps up the formal presentation, right, Caleb? Right. This will be continued at our task group meeting, which is Wednesday, November 14th from 5 to 6:30, so it's the day before the annual meeting. The meeting this year is at the Sheraton Inner Harbor in Baltimore, Maryland, and we hope to see you there. So Caleb or Angie, do you have anything else to add? Otherwise, we completed our task in 25 minutes, which is exactly what you asked us to do, Caleb.
Yeah, perfect. And so what we'll do now is I'm going to go ahead and stop the recording, but thank you all for attending, and we'll see you at the annual meeting. And then if you want to stick on for another 3-4 minutes here, and we can have just a short discussion. But thank you, and we'll stop the recording.